I am Dr. Hrishikesh Pai, consultant gynecologist and infertility specialist. I have been in the field of infertility and gynecology for the past 25 years, and presently I am the medical director of Bloom IVF Group, which has got 9 IVF centers all over India, including 5 centers in Mumbai, 2 in Delhi, 1 in Mohali and 1 in Bangalore. We have been doing high-end infertility work such as IVF, ICSI, egg donation, embryo donation, semen freezing, egg freezing, embryo freezing, surrogacy and all other kinds of advanced technologies like IMSI, embryoscope, laser hatching, etc. And we have been providing this service to more than 25,000 patients over the last 25 years. Egg freezing or oocyte freezing is when you freeze your eggs. Normally, many of these younger women, they don't like to get married that soon because of their careers, and in that case they want to postpone their fertility. Also, many of them don't meet the right person to get married to, and as a result of which they would like to have the choice of having their eggs frozen for future use. So in egg freezing, what we do is we give some medicines to the young women, who then we produce a lot of eggs, and after these eggs are produced, they are retrieved by a vaginal sonography machine. It's a very simple procedure of 10 minutes and is done under sedation or mild anesthesia. After that, you can go home in 3-4 hours time. Those eggs that are removed are then frozen in liquid nitrogen and stored in liquid nitrogen at minus 200 degrees centigrade. And as and when after 5-6 years, 8 years, 10 years down the line, when the lady gets married and when her fertility is too low, she can use these young eggs that she froze 10 years before, and she can take those eggs out, thaw them, use her partner's sperm, make the embryos and put them back into a womb. So it gives us her chance to preserve her fertility for future use. It also can be used for other purposes, such as we use it for our egg donation program. We can actually use donor eggs to give pregnancies to patients. But in the present times, we use fresh eggs, and in using fresh eggs, there is always a possibility that there may be a transmission of viral infections such as HIV. So in frozen eggs, you can take the eggs out of the donor, you can freeze them. After 6 months, you can do a HIV test on the donor and see that she is free of any viral diseases like HIV, and then use those quarantine eggs for the egg donation program. So in this way, you totally eliminate the chance of transmitting a HIV or a hepatitis B or a hepatitis C virus to the recipient. The egg freezing program can also be used for patients who have cancer. Many of these patients, they undergo chemo and radiation therapy, and this therapy can totally destroy their ovaries. So prior to the chemo and radiation therapy, you can take the eggs out, freeze them, have the chemo radiation therapy. Many of these patients, if the cancers are detected earlier in their life, they can have total cure from the cancer. So after the total cure is there, after 4-5 years, when they get married and they decide to have families, they can use the frozen eggs and have families of their own. Career nowadays, there is a lot of competition, and in case you become pregnant, then woman has to take a back seat, and that 1 year or 2 years of getting a back seat can allow your colleague, a male colleague, to go further in the career. So that definitely has an impact on the women's career. So in this way, she can freeze her eggs, so she can continue her career, and afterwards, when she is settled down in her career, then she can go for the fertility preserved eggs and have a family. So by having an egg freezing option, she gets a equal status in competing with her male colleagues. In social egg freezing, first is, of course, we do a ovarian reserve testing, and that is done by doing a hormone assay called anti-Mullerian hormone test, and also we do the ultrasound assessment of the ovaries by doing an antral follicle count. After that, we stimulate the patient by giving her hormone injections for 10-11 days and monitor the stimulation by using transvaginal ultrasound. After that, when she is ready, we give her a mild sedation or anesthesia and retrieve the eggs by vaginal ultrasound, which is a 10 to 15 minute procedure. She can go home after 4-5 hours when she is fully recovered back to her senses, and then those eggs are frozen in liquid nitrogen. So it's a relatively simple procedure with minimal chances of any complication. So we, in the olden days, first egg freezing baby was born in 1990. But in 2002, the new technique of vitrification came in, and that really changed and did a paradigm shift in egg freezing techniques. Nowadays, we use the vitrification technology to freeze eggs, and the advantage of this technology is that the recovery is nearly 90 to 100%. So, if you freeze 8 to 10 eggs, when you want to recover these eggs by thawing them, almost out of the 10, almost 8 or 9 eggs will recover fully. So, that's a real big advantage and a real big leap in technology. Success rates are the same as the time at which you freeze the egg. So, if a person is 35-year-old, the pregnancy rate of IVF at that point in time is around 40%. So, after if you freeze your eggs at 35 and then you use them at 42, the success rate will be 35 to 40%, which was there at the age of 35. But if you freeze the eggs at 39, the pregnancy rate is at that point in time is, let's say, 15-20%. So, then you use the eggs at the age of 44, then your chance of pregnancy will be 20%. So, the age at which you freeze the eggs, the success rate of that person at that point in time will be the success rate whenever you use the eggs in the future. And hence, we advise that if at all you need to freeze your eggs, you need to freeze them before the age of 35, preferably before the age of 30, when your reserve and your fertility is at a very high level, so enough eggs can be frozen. Many of these patients, they are coming to me at the age of 39 and 40. At that point in time, your ovarian reserve is already depleted, and we can't really freeze a lot of eggs. As far as the safety of egg freezing is concerned, a lot of studies have been done now, because as I told you, egg freezing has already been used for the frozen egg donor program extensively, including in our group in Bloom IVF in Lilavati Hospital, in Fortis Hospital, in DY Patil Hospital, and the outcomes are similar. There is no difference in outcomes as far as the malformation rates are concerned, as far as the delivery rates are concerned. So, the procedure is quite safe. If you want to meet me and consult me, then I am always available for you all over. You just need to visit our website. However, I am always available on second floor IVF department at Lilavati Hospital, Mumbai, Bandra, and also available in Fortis Lafayette Hospital and Fortis Hospital, Gurgaon in New Delhi. I am also available at the Fortis Mohali Hospital in Chandigarh. We are also available at the Sakra Hospital in Bangalore and the DY Patil Hospital in New Bombay, Navi Mumbai. My contact email ID is hdpai@hotmail.com.